Dr. Cary here. Welcome to today's webinar, and we'll be talking about back pain today. And it's part of our series of 100 days of getting healthier. And at the end of our 100-day journey, we want to be healthier than we were on day one. And today is day 12, and we're working towards getting better in the 100 days. And day 12 today, we made a plan on day one. We started to execute that plan. We learned about stretching. We learned about posture. We learned about strengthening. And so now we're moving into back pain today. And we want to talk more about back pain. Last week, we talked about neck pain. And today it's going to be more about back pain, and tomorrow about sciatica. And then we're going to talk about nutrition for your joints the day after that. So today for back pain, it's the most common thing we see in the clinic. Most of our patients come in for back pain. So this is a very popular question that I get. And we really want to talk about what we can do to help people. Don't forget on Saturday morning, I'll be having coffee with me, with Dr. Cary, and please join me. It was fun the last 2 weeks doing coffee. I had a chance to answer questions. If you have any questions, please type them in the chat. I'll just put a message here in the chat on YouTube. And if you're on Instagram or Twitter, please type in the comments and I'd be happy to answer your questions. So at coffee, we talked about what we did last week, what we're going to do this week, the masterclass on posture. I think the next masterclass will be on nutrition. It'll be a follow-up to our topic coming up on Thursday, nutrition for the joints. Clinic hours, I'm in Tuesday through Sunday this week. So if you'd like to book an appointment, we still have some openings. We are taking new patients in the clinic. So feel free to book an appointment online, and you can easily just click on the link in the show notes or in the bio on Instagram and Twitter. So today we're talking about low back pain, and I've got some slides here on YouTube that I'm going to go over. So for low back pain, what can we do to help people? And again, in this 100-day period, we are working on reducing pain, improving mobility, improving posture, and enhancing health. That's our goal in these 100 days. So for low back pain, where does it come from? A majority of low back pain either comes from, it gradually comes on, so it just spontaneously comes on from misalignments and poor posture over a long period of time. Sometimes there's an injury or an accident, like a car accident or a sports injury, that immediately causes pain. And sometimes people can sleep wrong or have the bad posture sitting at work or in their work position. Maybe they're doing some electrical or plumbing, that kind of thing. Truck driver, a nurse that's lifting a patient. So we do see people coming in that have had a certain posture or pinched a nerve because they've been in a certain position. So how do we approach it as a chiropractor? Well, the first thing we want to do is understand how the pain got there. And as a chiropractor, we want to do a history. And then based on the history, we want to make sure we have a good diagnosis for the problem so we can do the proper treatment. So the history is very important, and we do a very thorough history to understand where it's coming from. And then we do an examination. And then the examination includes an assessment and different testing, orthopedic, neurological testing. And then we have a diagnosis and some differential diagnosis in order to determine what we're going to do to help people. We also want to give people recommendations on how they can help themselves. So what you can do to help manage the pain, to improve the motion and the mobility, improve your posture, and better your health down the road so it doesn't come back again. So we definitely want to talk about that and discuss that with our patients going forward. For low back pain, what we're talking about is the lumbar spine. And if you can see my screen here on YouTube, this is the green vertebrae here, the 5 vertebrae called the lumbar spine. Normally, the lumbar spine curves forward like this into a lordosis. And sometimes we'll see people that have a flattened lordosis, so they don't have a curvature like that. Sometimes we'll see people with a increased curvature as well, a hyperlordosis. And that can squish the discs here and then cause a bulge like this one right here, called a disc protrusion that can pinch the nerve. So sometimes we see soft tissue changes, or there can be soft tissue changes because of misalignments. Other times it's bones that are out of place that are pinching nerves, or tissues around the bones that are affecting the nerve flow. So we're talking about 5 vertebrae. We count them down from top to bottom, L1 being the top, L5 being the bottom. The most commonly injured and affected segments are L4 and L5, and the junction between L5 and the first sacral segment, S1. And this is where the sciatic nerve comes out. It's the largest nerve in the body. It comes down from L4 and L5, and the first 3 sacral segments, S1, 2, and 3, those 5 nerve roots make up the sciatic nerve. And there's one on the right side and there's one on the left side of the spine, running down your leg right to the tips of your toes. For a chiropractor, when someone comes in, we're looking for the alignment of the body. So what's the alignment like? And is the posture proper, or is there slouching or a sway back or a flattened curve? Sometimes we'll even take x-rays if we think it's warranted to look at the alignment, the condition of the spine, and if there's any pathology there. Next, we want to look at the function. What's the range of motion like? What's the person able to do and not able to do? Are there certain movements that they can move in better than others? So we really want to make notes of that. They're all clues as to what's causing the problem, the pain and discomfort for the patient. And then we want to look at the tone of the muscles. The tone of the muscles in the area tell us something about what's going on underneath. So we want to look at the tone. Is there a tight tone? Is there a loose tone? Is there inflammation or swelling? That gives us indication of what the underlying condition is like and what's going on and why those muscles are tight and protecting that area. What can we do about it as a chiropractor? Well, number one is we want to do some adjustments to the spine. The adjustments are done by hand or using an instrument, sometimes the table. And by doing these adjustments, it helps to realign the spine, increase the range of motion. We want to give the patient good advice. And the advice is to take good care of that area. So reduce the swelling, reduce the pain, increase the range of motion. But initially, sometimes they just need rest. So we want to make sure the patients are getting the right amount of rest and recovery time so that their back can get stronger and get better. Then we want to give patients stretches as they progress through care. I like yoga type of stretches, so yoga postures, cat and dog, other types of yoga positions to help stretch that area. And by stretching it, it maintains the alignment and the function. It improves the circulation of the nutrients in the joint, takes away waste products. So that's very important. Then we want to teach people about posture. What's good posture, not just for that area, the low back, but make sure their posture is good in the upper back and their neck. They're wearing the proper shoe wear. They have the right postural supports at work or at home, in their car. So all of those things, their bed, their mattress, it's very important. Then we want to talk about core strength. As the alignment improves, what can they do to support that? And core exercises are important. I do core exercises on a regular basis. I did my workout this morning, but the core is just building that strength around the spine. We want to talk about nutrition, and we're going to be talking about that in 2 days. So join me here on Instagram, Twitter Live, and YouTube. We'll be talking about nutrition to improve the condition of the joints, and that'll be things like collagen that we'll be talking about on Thursday. So please join me for that. And then we're going to be talking about lifestyle too. Just certain things you can do to make your the environment better for your back, your lifestyle more conducive to healing and to staying healthy for your back, and things you should avoid. So we'll be talking about that as the week progresses too. Tomorrow we'll be talking about sciatica, so please join me tomorrow morning as I'll be talking about that. If you're interested in becoming a patient, you can click on the link in our bio on Instagram and Twitter. Here on YouTube, you can click on the show notes. There's a link in the show notes. You can also scan this QR code in the corner. It'll take you to the scheduling link, and then you just choose initial appointment in the menu. If you have any questions, please type them in the chat or in the comments. I'd be happy to answer those, even if we're not live anymore. I'll check the messages in the comments from previous episodes. Usually we can get a patient in within 48 hours. So if you're interested in coming in, we can usually get you in today or tomorrow. So please feel free to make an appointment. We know a lot of conditions are urgent. People are in pain. So we want to get you in as quickly as possible to deal with that situation and that urgency. And then make sure you join me for the next 88 days, because we're on day 12, and we'll be talking about all sorts of different things that you can do to reduce pain, improve mobility, improve posture, and enhance your health. So this is going to be a great journey. It's already started off really well. I know my own health is better because I'm just focusing on this and doing things that I need to do to improve my health. But I encourage you to join us for the next 88 days. I hope you're getting better, you're getting healthier, stronger, and I look forward to talking to you soon here on social media, on YouTube, or in the clinic.